In 2025, there are going to be a lot of changes to Medicare, but more specifically, some of the biggest changes are going to be happening to Medicare Advantage plans. Is it because of bureaucracy? Is it because of budget? Is it because of efficiency at the sacrifice of choice? Maybe. But either way, today we are going to be discussing the 5 biggest changes to Medicare Advantage plans in 2025. So that could be Medicare Part C plans, MAPDs, Medicare health plans, whatever you want to call them, they're going to be changing in 2025. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare option for them in the AEP, or really all year round, give us a call at the information down below and we can help them to make those or you tough Medicare choices. The Medicare Advantage plan is a relatively new invention as far as Medicare programs go, which means it is still kind of undergoing a lot of tweaking by the Medicare facilitators to try to get them in line with budgets, with efficiency, and with healthcare. And that can mean sometimes putting limitations on how the plans are used, increasing benefits, or changing the structure altogether. And in 2025, there are going to be a little bit of each. So here are the 5 biggest changes to Medicare Advantage plans in 2025. First and foremost, the biggest change to Medicare Advantage plan is going to be more of a technical issue, but really makes them all the more valuable because they are requiring beneficiaries to have both Medicare Part A and Part B to be eligible for an MAPD. That has always been the same, but the big change is going to be that there is going to be an increase in the cost for Medicare Part B, which could put a little bit more strain on folks' Medicare budget. Now, although the exact number has not been put out yet, it is estimated to be around $185 in 2025. This is roughly $10 more than it was in 2024, where it was $174.70 a month. So although an additional $10 isn't that much more, it means more and more of folks' Social Security benefits, of their retirement benefits, of their retirement savings, of their working income is going to be eaten up by Medicare Part B, just so they can have the minimum eligibility for a Medicare Advantage plan. Another really big change that is going to come to folks on Medicare Advantage plans in 2025 is going to be the enrollment periods have changed a bit. Again, now I know they were just moved around a few years ago so that they limited folks who were enrolled in Medicare and who got assistance from a state Medicaid program referred to as Medi-Medi or dual eligible individuals, who back in the day, they could change their plans whenever they wanted, month to month, willy-nilly, every single month. Back then, that sort of got out of control and it got moved to one time every 3 months up until 2024. And now in 2025, we're back to a monthly change once again for Medi-Medi folks. But there is another really big change and it's going to put a pretty giant restriction on those Medi-Medi changes monthly, but we'll get to that here in a sec. Next up is applicable to Medicare Advantage plans that also include to Medicare Part D coverage for Medicare prescription drugs, which is the vast majority of those plans that are available, at least here in Southern California. The change is to the Part D portion of MAPD. So there is finally a cap on how much a Medicare beneficiary could pay for their prescriptions in the year. And you may be thinking, well, wasn't that always the case? And you would think, but actually no. Up until 2025, there was no functional limit to how much a beneficiary could pay in the year for their prescription drugs. And there was a donut hole, which meant that their costs would go up dramatically and then drop down, but still had no limit. Now, all that is gone. And I say, bravo, a win for the Medicare kids. Another change that I'm going to put in the not so good category that is going to have an effect on the ability for Medicare beneficiaries to enroll in Medicare Advantage plans is a new restriction on enrollment for folks who are enrolled in the Low Income Subsidy Program or LIS program. The LIS program is a federal program that helps folks pay for their prescription drugs, and the income limit on it is considerably much higher than is required for Medicaid or Medi-Cal, as it's called here in California. Prior to 2025, folks who had income that was too high to get full Medi-Cal assistance but could qualify for LIS had the option to change their MAPD plan that also included Medicare Part D coverage one time every quarter throughout the year. It also meant that if they missed their open enrollment period, they could still get enrolled into an MAPD, even if it was the middle of the year, to help them pay for their Medicare costs and their Part D drug costs. But now, moving forward, this is not going to be the case. Those folks with LIS will now have to wait to enroll or make changes to their MAPD plans until AEP, the annual election period, and cannot change monthly like the folks on Medicare and Medicaid or dual eligible individuals. And last up today is going to be an adjustment to the types of Medicare Advantage plans that Medi beneficiaries can choose outside of the annual election period. So at the top of the video, I talked about the fact that the 1 per quarter restriction on Medis is lifted in 2025, meaning that they can change their plans every single month. But to keep things from going awry as they did back in the day, the plan that folks will be able to enroll into are going to be much more restricted, because although they will be able to make changes monthly, they will only be able to enroll in specifically fully integrated dual eligible Medicare Advantage plans or switch back to original Medicare and standalone Part D plans using that Medi SEP. For LIS, they too are going to be limited to changing their Part D plans or leaving a Medicare Advantage plan and going back to original Medicare and a standalone Part D plan outside of the AEP period if they want to use their LIS SEP. This type of restriction is to prevent people from moving from dual eligible plans, specifically designed for folks who are Medi, into normal MAPD plans that don't fully accommodate their needs, but at the cost of Medi beneficiaries' choice. Which is more important? I guess that's already kind of pre-decided for Medicare beneficiaries, but if you disagree, write your congressperson. I guess, I don't know. So there you have it, some of the biggest changes that are going to affect Medicare Advantage plans in 2025. The first one is that Medicare Part B premium is gonna go up, no surprise, and thus making it more expensive to stay enrolled in a Medicare Advantage plan. 2 is the change in the special enrollment periods for folks who are Medi or dual eligible. 3rd is the cap on the total cost for medications during the year if someone has an MAPD. 4th is the limitation on when LIS eligible beneficiaries can change their Medicare plans. And finally, the types of plans that are available year-round SEP enrollment for dual eligibilities become much more limited. Now, if you have any questions about these programs or really anything else related to which Medicare options may be right for you, please don't forget to like and subscribe and follow so you can stay updated with our newest Medicare information, or also you can give us a call at the information down below, or check out our other great Medicare content on the socials, on YouTube, on Instagram, because we have new Medicare content coming out every single week. So that is it for today for Michael's Medicare, and of course I am Michael, hoping that you have a great rest of your day, and goodbye.